You've probably heard the promise of AI for good, right? This idea that we can use incredible technology to solve the world's biggest problems, especially in something like global health. But what happens when those amazing, well-intentioned solutions actually make things worse? Today, we're going to dig into the story of an AI that was built to save mothers and babies and how it fell into a trap that almost no one saw coming. To really get what's at stake here, we have to start with this number. In Zambia, a newborn baby dies every 30 minutes. It's a devastating maternal health crisis, and it's exactly the kind of urgent problem that seems perfect for a high-tech solution. And, well, that's exactly what happened. An intervention arrived, and it was called DawaMom. Now, this wasn't some simple app. We're talking a seriously sophisticated AI platform. Think vision transformers that can spot cancer and medical images, and advanced language models that can chat with and support expecting mothers. It was meant to be a lifeline. But then, something started to go wrong. That lifeline, it wasn't reaching everyone. And for some of the women it did reach, it was creating entirely new problems. So what happened? How did a tool designed for good end up becoming a tool for inequality? That's the big mystery we're unpacking today. So before we even start looking at a single line of code, we have to understand the reality on the ground in Zambia. Because, you see, the first failure here wasn't technical at all. It was a failure to see the world that existed outside of the lab. And this number, this just says it all, 67%. That's how much of the population in Zambia is offline. We're talking about 14.5 million people. The AI was built for a world that's always connected, but most of the women it was supposed to help were living in a disconnected one. Right away, this created a kind of silent filter that just instantly excluded the most vulnerable people. Okay, so what about the women who could get online? Well, they ran into a whole different problem, a major culture clash. The AI's advice was all based on Western biomedical data, but it was being given to women who rely on ancestral knowledge and traditional practices. This quote from a Zambian mother just hits the nail on the head. When the AI dismissed local wisdom, it destroyed the single most important thing in healthcare: trust. And here's the crucial thing to understand. These failures weren't just random bugs in the system. No, they were the direct result of choices, human choices, made at every single stage of building this thing. So let's pull back the curtain and see how that bias actually gets coded in, step by step. You can literally trace the bias through the whole AI lifecycle. It starts right at the beginning with the framing, just deciding what health even means. Then you get to the data that's used to train the AI. After that is the modeling itself, how the AI actually tries to make sense of all that data. And finally, it all shows up in the user experience. At every single step, a choice was made that pushed some people further and further to the margins. Let me give you a really concrete example of how this plays out. So the developers didn't have much local data, right? So they used these big, standardized Western data sets. So when the AI saw a mother's body reacting to a traditional herbal tea, something used for generations, it had no context. It just saw an anomaly, a clinical disorder, not a deeply respected cultural practice. And that's not just a small error. That's a genuinely dangerous misinterpretation. Okay, so now that we've seen how this inequality got baked into the system, we can actually start to give these failures specific names. Researchers have basically developed a way to perform a forensic analysis to diagnose exactly what kind of bias went wrong where. And this chart breaks down the 5 big types of bias that really infected DawaMom. First, you've got representation bias, because traditional knowledge was just completely missing from the data. Then, measurement bias, where the AI only measured things like blood pressure instead of holistic well-being. Next up is aggregation bias. That's when you assume a one-size-fits-all model works for everyone. And finally, you had language and deployment biases. Everything from the confusing clinical terms it used to the simple fact that many women didn't even own a phone to begin with. This quote, man, this gets right to the absolute heart of the problem. Bias is the shadow cast by a scaling strategy. The desire to build one single universal solution that you can just roll out across the entire globe, that's what creates the problem. The second you try to standardize for everyone, you have to decide which people, which realities get averaged out and left behind. And this whole story, it takes us way beyond DawaMom. It opens up a much bigger, much more important global conversation. It's really about who gets to decide what's true. Who gets to define what counts as valid knowledge inside our AI systems? And there's a name for this. It's called epistemic justice. And it's such a powerful idea. It basically says that local, indigenous, and traditional knowledge isn't just culture that you have to work around. It is a valid form of data. It's a legitimate form of truth that absolutely must be a core technical requirement if you ever want to build a system that's truly fair. This chart right here just completely shatters the myth of the default human that so much of Silicon Valley designs for. You know the one, the assumption that everybody is online, digitally literate, and has their own personal smartphone. But the reality in Zambia? Fewer than half of social media users are women, and less than half of young people even own a mobile phone. That default human just doesn't exist.
Okay, so we've diagnosed the problem pretty thoroughly. But what's the solution? What does a better future actually look like? How do we get from these well-intentioned failures to real, on-the-ground, equitable solutions?
And here's the key insight. The answer isn't just about getting more data or writing a better algorithm. It's about putting a human back into the loop. The new model that's emerging is a human-AI hybrid. It uses community health workers as trust brokers. They're the bridge. They stand between the AI and the patient, translating the clinical advice in a way that makes sense locally. And, just as important, feeding those local realities back into the system. And look, this is not just some nice theory, it's actually happening. Zambia is taking the lead. They became the first African nation to join a global regulatory network for health AI. They're flipping the script. They're going from being a test bed for Western tech to being a leader in defining what safe and fair AI looks like for their own people. So we're going to end with this challenge, a question to bring this whole global story right back home to you. Think about a piece of technology you use every day. Ask yourself, who is this designed for? And more importantly, who does it serve the least? Who's being averaged out in that quest for scale? And what would it really take to flip it all around and redesign it to serve them first?